All right, guys, so we're going to take a little bit of a look at kind of introductory for the skeletal system as well as some of the bones of the skull. So we'll cut into this fairly quickly here. So the skeletal system is broken up into a couple different parts. We have bones, joints, cartilage, and then as well as ligaments. We're going to spend most of our time on these two up here at the top. We're not going to kind of we'll touch a little bit on cartilage and ligaments. This is some of the stuff that if we would have been in person and been a little bit more in time, we would have spent quite a bit of time on. But we'll spend a majority of our time up here. The skeletal system is then divided into two divisions. We'll take a look at it here in just a second, both the axial as well as the appendicular. All right. So the axial skeleton is highlighted in green here. It's got essentially a couple different divisions. We've got the skull itself, which is comprised of several bones. We have the vertebral column, and then we have what's referred to as the bony thorax, so the sternum and some of the cartilage that kind of extends from that. Right, those are the basic sections of the axial skeleton. Appendicular skeleton is mostly our limbs, the pectoral girdle, which would be the collarbone, clavicle essentially, and then the scapula, and then the pelvic girdle, which are the coxal bones on either side that then the femur attaches to. Okay. A couple of basic functions of bones. They're there specifically to support, right? They do some protection of soft organs. So a lot of our main organs, our heart, lungs, are kind of housed up in there, kidneys in the back. They are the main attachment point for skeletal muscle tissue, which then provides us with movement. They do store some minerals for us, specifically calcium as well as fat. And then they also are the site of blood cell formation, that hematopoiesis that we talked about during the blood unit. With the human skull, adults, we have about 206 bones. And then there are two main classifications. We have what's referred to as compact bone, which is solid. So you can see the picture down here, or as well up here at the top. It's not porous. And then there is spongy bone, which has kind of this honeycomb-like structure within it. So it's much more porous. Most bones on the outside have the compact bone and then some spongy bone in the center. This is actually a picture probably down here at the bottom of the skull. And then this would be more of kind of a long bone. You can see we've got this kind of compact bone towards the outside, and then this honeycomb-like structure, spongy bone in the center. We have four main classifications of bones. We have long bones, short, flat, and then irregular. And we'll kind of take a little bit of a look at each one of these. These are the ones that should have been in your bones worksheet as well. So if you got that handy, this might be a good time to pull it out and make sure you got everything. So the first one here we have are the long bones. These guys are usually typically longer than they are wide. They have comprised of a shaft, and then they have a head at both ends. So they have a proximal end and a distal end. You can see here. Examples of those would be like your femur and humerus. You would also have like your radius, your ulna, tib, fib. Those would also all be examples of those kind of long bones there. All right. Next ones we have are shorts. They're usually kind of cube shaped, primarily spongy bone, and then those would be comprised of carpals, tarsals, and then also your patella would be an example of a short bone. Next one we have are flat. These guys are usually thin, have a little bit of kind of a curvature to them. They usually have layers of both compact as well as spongy bone. All right, big examples of those guys are here. So skull, ribs, and sternum. And then the last classification we have are irregular ones. So these are ones that just don't really fit in some of the other categories. So they simply just have an irregular shape to them. All right, and these would be similar to like your vertebra as well as your coxal bones that make up your hip. Okay, real quickly, just we can use specifically in forensics, we can use parts of the anatomy to actually identify remains. And the way that they do that is they can do a height calculation. So they can use lots of bones in the body depending on what they have. This is just an example of the ulna. So this ulna is 24 centimeters long. We know that there is a calculation that we can use for that. It's not something you guys need to remember, but there's a basic calculation that we can use to figure out a range of what this person is, and then we can simply convert that to inches so for the American system, so we know how tall they are. Okay. With long bones, there's a little bit of some anatomy that we need to know. So there's two basic kind of parts. The first part's what's referred to as the diaphysis. This is the shaft of the long bone here. So this is the middle section. All right. And then we also have what's called the epiphysis. And there are two of them. There's a proximal epiphysis and a distal epiphysis. So those are the ends of the bones. Diaphysis is mostly compact bone. Epiphysis is usually spongy bone. In adults, we have this kind of don't have a growth plate, but your growth plate would be this kind of epiphyseal line that usually is at the end of both bones, from which that growth kind of takes place at. Some other structures we see in the bone is what's referred to as the periosteum. All right. Periosteum is just simply the outside covering that goes around the diaphysis. And then we also have some arteries that are supplying. So this is one of the reasons why if you break a bone, you usually have some pretty significant swelling because there is arteries running through that bone. Okay. Some other structures we have is what's referred to as articular cartilage. This covers the ends of the epiphysis, right? So this would be kind of in this region here, and then down here on this region. It's mostly hyaline cartilage, kind of that soft, kind of spongy cartilage, and it's there specifically to decrease friction. Right. We also have what's referred to as the medullary cavity. This is simply the cavity that's in the shaft. The big thing that here is that it contains both yellow as well as red marrow. So yellow marrow mostly in adults, and then the red marrow mostly in younger individuals. But there's kind of this basic shaft. If you've ever gone out to some restaurants, it's a new thing now. Not new, I suppose, but it's a thing that we sometimes use. They do bone marrow as a serving, so they'll actually cook this portion of the bone of like a cow or a pig, and then they'll serve that marrow that's on the inside. This just shows you a little bit more of kind of what that looks like. This is actually the head portion of the humerus, probably here, and you can see there's a little bit of a wearing away, so we can see that spongy bone in the inside, and then this compact bone on the outside. All right, and then this is just showing a little bit of the marrow. Again, you got compact bone on both sides. This is the cavity, the medullary cavity in the center, and that's where that marrow is at. All right, so let's get into a little bit of the skull bones. All right, so there's two sets. There are cranial and facial. There are 8 cranial bones, 14 facial. These bones are actually joined by sutures, not joint. So they are a joint, but they're a line that is kind of in there. And then the only freely movable one is the mandible. All right, that's one of the big things that we need to know there. Fetal skull was a little bit different than an adult skull. Fetal skull has these little things called fontanelles. So these are essentially openings in the skull that are closed up by fibrous connective tissue. They allow a couple things. So our brain's not done growing when we're born, so they're there for expansion. They also provide some flexibility during labor. All right, so these bones can actually move together to allow them to move through the birth canal. And then they usually start to convert to bone within about 24 months, right? Which is why babies, they usually have a soft spot on both the top. So there's an anterior, right? And then there's a posterior one as well. There are several here on the side, but those are just kind of the openings in the skull. This just shows kind of the results. This is probably a natural childbirth baby over here on the left. And this is probably a baby. Well, I think they're actually the same babies, but this is representing what it would look like after natural childbirth. This is what it would represent if they had a C-section. But this baby has had their kind of skull reshaped, and sometimes you'll see babies wear these because for some reason those bones aren't kind of growing back together. Okay, with the skull, this is a side view here that we have, and I'm going to kind of highlight a couple of basic structures that I think you need to know. So starting up here at the top, this green bone here is the parietal bone. There are 2 of them, one on either side of the skull. The orange bone coming down here is the temporal. That's right above your ear. Right, this is be your ear right in here. All right. The brown bone on the back is the occipital bone. Okay. Let's see. There are a couple processes here. I'm not specifically don't think we're going to make you guys remember those. So this is the mastoid process, styloid process. This is where a lot of our muscles attach to. Moving over here to the right-hand side, you've got the yellow bone up here at the front, which is the frontal bone. This little bone here on the side is the sphenoid bone. It actually makes up the back portion of your eyes, right? It kind of has a butterfly shape to it, and I'll show you that here in a second. On the inside portion of the eye, there are two bones. There's the ethmoid bone towards the back, more posterior, and then there's a lacrimal bone that's more anterior right here, right? The two bones that make up your nose, which are your nasal bones. Your cheekbones are known as your zygomatic bones. The upper jaw is the maxilla, right? And then the lower jaw is obviously the mandible. Okay, you can kind of see those. There are a couple sutures here that you might want to take note of. There's the coronal suture that divides the parietal bones from the frontal bone from the parietal bones. There's the lambdoidal suture that divides the parietal bones from the occipitals. There's what's called the squamosal suture. That's parietal bones from the temporal. All right, but those are those basic sutures that we see in adults. They're closed, which is another forensic thing we can kind of take a look at. If those are open when we find a body, then we know that we have a younger individual. If they're closed, we know that we have an adult. All right, this is just a frontal view that shows those a little bit better. You can see some of the same bones here. The big ones that we can kind of take a look at a little bit more from the frontal are the sphenoid bone again, that kind of goes all the way across the eyes. Another one here that you need that I would look at is the vomer. That's this bone that makes up part of the nasal septum. All right, you can see the nasal concha in there as well. You can see a much better picture of the maxilla and mandible. All right, and then you can see those basic bones we were talking about before, the ethmoid and lacrimal making up the inside portion of the eye right here. All right, and then you can see your zygomatic bones a little bit better, your cheekbones. Okay, this is an interior view of the skull, so looking down after we were to take the top off of it. This is the one that I specifically want to highlight here, right? So this is the sphenoid right here, and we say that it sort of looks like a butterfly, and if you kind of look at it, you probably can sort of see that basic picture. We got wings on both sides, body in the center. This is actually where the pituitary gland sits. It's a little section called the sella trucica, all right? But you can see the basic portions of those bones here. Okay, this is a inferior view of the skull. So we're looking at it from the bottom. You can see all of those basic kind of bone shapes there. A couple things here to take a look at. There is the hard palate. So the maxilla makes up the front, and then there's this little bone towards the back called the palatine bone that makes the rest of that up. Trying to make sure I can highlight a few other things for you. I think that catches most of them there for you guys. You've got your occipital condyles. This is where the skull actually articulates with the first vertebra. And then you've got this large opening in the center called the foramen magnum. This is where the spinal cord would kind of come up and through. Okay, I'm going to post this link for you guys so you guys can kind of go through and click and label some of those bones for practice. I think those are kind of helpful. One of the last things we'll talk a little bit about is there are some sinuses in the bones. So these are just kind of hollow portions in the nasal cavities. So there are several of them here. You've got frontal sinuses, ethmoidal sinuses, sphenoid, maxillary sinuses. These all are kind of in there to help lighten the skull. But this is also why when you get sinus headaches, this is kind of the area that we normally kind of talk about, this area kind of between the nose and eyes. Okay, so basic functions of the sinuses: lighten the skull, give some resonance as well as amplification to our voice, which is why when people have head colds, sometimes it does change the quality of their voice a little bit. Okay, last one we'll take a little bit of a look at here is a bone called the hyoid bone. This is the only bone in the body that doesn't really articulate with another one. It's kind of sit right there in kind of a little bit of soft tissue. It serves as a kind of anchor for your tongue so that you can move it. If you palpate kind of one side or the other of your voice box, you'll kind of feel that bone right at the top. But it's a kind of a horseshoe-shaped bone right there that sits underneath. Okay. And then I'll post this video again as well. It shows a little bit of that basic kind of swallowing process. And you can see that bone, which is right in here, move as that happens. Okay. All right. Go ahead and kind of stop there.